here's what nurses can do. It's very inspiring. So this should really come as no surprise, but a lot of focus is going to be on education. Nurses in a variety of roles can provide education. You know, we talked about advanced nurse practitioners or ARNPs or nurse navigators, even nurse case managers are involved in education these days. And there is no one, standard model. I think there's such a variety in our practice settings that we do have to take into consideration what resources we have and who are best primed to do these, to play these roles. So again, it's really important to provide both written and verbal education. This education should include how to take the medication, side effects that a patient could expect, and when to call. And this is the most important part of the education session. You need to make sure that you're assessing your patients and what their knowledge is after you've provided them with that information. Use the teach-back method. Ask them, can you tell me how you're going to take this medication? When do you need to call us? And really confirm that they have a good grasp, a good understanding of what they should be doing. Think about, are they going to need reinforcement or strategies to help them remember when and how to take their medications? If so, help them and provide those tools, whether it's a calendar, recommendations that they get a medication box, helping them set an alarm on their phone to remind them. Any of those types of strategies are really helpful. Think about, do you need to wrangle support from family members or caregivers? Because you may need to be providing education to those individuals as well so that they can really be a full support for our patients. Make sure patients know why their lab work's important. Again, a higher level of understanding is really important to keep them on track completing those necessary labs. Monitor for toxicities and provide advice on symptom management. Refer them to the provider if that's what's needed. Education doesn't just need to happen at the beginning. It's going to be a continual thing that's going to happen every single time you see them. As you're assessing for side effects, you're walking your patients through everything you're looking for, which is a really good reminder for them about what they should be looking for and reporting as well. So if you get the sense that they're worried about the potential for a dose reduction or an interruption in therapy, if they report side effects, you can also provide the education that just because that happens, that doesn't mean that they're not going to achieve a response. Encourage your patients to talk with the doctor about how they plan to continue measuring their response throughout treatment. Empower them to be active in their medical care and have those open conversations. If you're providing education to your patients, you as nurses also need to continue to grow your own knowledge. That's really important. So how do you stay up to date with all of the new information? I can tell you as a pharmacist who deals with these medications, that's a real struggle. I get alerts actually once a week that tell me all the new approvals that have happened. So I quickly read through all of those. So that's how I try to stay on top of it. But if you're not using it using these medications or seeing them on a daily basis, that it's hard. It's hard to remember all of those things. Okay, what's this drug specifically approved for? There's just so much to know. So I think just trying to stay up to date and having a strategy is something to think about. Because drugs, again, are popping up every month. I know there's a requirement for continuing education for nurses, but what about in-services at work? How does your organization support you in building on your knowledge so you can care for your patients in a manner that's high quality? Do you subscribe to the professional journals? How much do you get out of that? I encourage everyone, and I tell my pharmacists this as well, to develop a plan. to create this oral chemotherapy education. And how many of you guys know about that website yet? Okay, not too many. So this is my great find in the last couple of months. It's actually really, really good. Do you guys agree? Do you like it? Okay, I do too. This is a website that contains a library of patient education for all the oral drugs. So it's just really oral chemotherapy focused. There are links to the drug-specific website, prescribing information. I felt like the handouts are really geared to our oncology patients and address things like handling of the medications and handling of body fluids and waste, because we always get tons of questions about that. It gives patients information on how to manage side effects and provides really good explanation on that. It also addresses pregnancy and sexual activity. So again, probably one of my favorite finds in the last few months that has been a really good resource. The Hematology Oncology Pharmacy Association also has some additional oral chemotherapy resources that I found helpful. Then the last one I'm going to talk about is Avella Specialty Pharmacy. They have a really good oral chemotherapy monitoring and counseling chart. It's a great quick reference when you're providing education to patients, so you don't forget anything that you want to highlight and make sure that you want to talk about. So honestly, I think that nurses are one of the first members of the healthcare team that patients interact with when they come into clinic. And that interaction really sets the tone and can work to reassure patients about their care. You know, what they know, what they can do. You can help build their confidence because, again, we're relying on them to do the work that's really important when they're not with us in clinic, with the providers. I know nurses already have meaningful interactions, but I wanted to include this slide because I want to acknowledge the impact your interactions have on our patients. You often develop relationships with patients that foster that trust and build their confidence so that they're more willing to report any problems. It's important to ask questions in a way that allows for open and honest communication without judgment so that